Jaundice history. Alamin! Abnormal growth inside the womb or uterus of a mother. Tututukan! Good afternoon, Cotabato State University. Good afternoon, South Central Mindanao. I am Angelito Junior Montuerte Fernandez, student of BP-SP 1B. This is P News. What is Jaundice? Jaundice is a condition in which the skin, whites of the eyes, and mucous membranes turn yellow because of the high level of bilirubin, a yellow-orange bill pigment. Jaundice has many causes, including hepatitis and gallstones tumors. Jaundice is a liver disorder, which happens due to release of substance called bilirubin in the blood. This discharge of substance gives the skin and urine the dark yellow color. And in many cases of yellowness also occurs in the white part of our eyes. Taking a Jaundice history. Duration of Jaundice, associated pain, previous episodes of Jaundice, chills, fevers, systematic symptoms, exposure to prescribed OTC and legal drugs, weight loss or anorexia, and also history of injection or blood transfusion. The mode onset of Jaundice often provides the pathophysiologic basis, if not the specific diagnosis at its root. Jaundice appearing over a few days to a week implies hepatitis, whether drug or toxin induced, viral or bacterial, such as leptospirosis. Symptoms associated with Jaundice often provide a diagnosed normal pain. Frequently accompanies Jaundice, and in its character may point to a specific diagnosis. Although hepatocellular Jaundice is usually painless, a dull ache or heavy sensation in the right upper quadrant may attend acute hepatitis of any kind. How about Jaundice newborn babies? Also babies or some babies have Jaundice condition, have a yellow coloring of the skin and eyes. This happens when there is too much bilirubin in the baby's blood. What can cause Jaundice? During production of bilirubin, Jaundice can cause by viruses, including hepatitis A, chronic hepatitis B and C, and Epstein-Barr virus infection. It also in alcohol and autoimmune disorders and also rare genetic metabolic defects. After bilirubin is produced, Jaundice may be caused by obstruction or blockage of the bile duct from gallstones, gallbladder cancer, and pancreatic tumors. What are the symptoms of Jaundice? Jaundice, sometimes the person may not think symptoms of Jaundice, and the condition may be found accidentally. The severity of symptoms depends on the underlying causes and how quickly or slowly the disease develops. And if we have a short-term case of Jaundice or usually caused by infection, you may have the following symptoms and signs such fever, chills, abnormal pain, flu-like symptoms, change in skin color, dark-colored urine or the clay-colored stool. In a summary of Jaundice presents with yellowness of the skin and mucous membranes, right? The cause can be physiological or pathological to abnormalities in bilirubin metabolism. Up next, abnormal growth inside the womb or the uterus of a mother. Tututukan sa pagbabalik ng PE News. This program is brought to you by PE News Center Incorporation. Go safe, out safe, keep safe. Nagbabalik ang PE News. Abnormal growth inside the womb or uterus of the mother. Pakatutukan. What is intrauterine growth restriction? Intrauterine growth restriction or IUGR is when a baby in the womb, a fetus does not grow as expected. The baby is not as big would be expected for the stage of a mother's pregnancy. This timing is known as unborn babies or gestational age. These are the two types of intrauterine growth restriction. The first is symmetrical uterine restriction. It is affected from nauseous effect very early in the phase of cellular hyperplasia. Total sale of a baby is no as less. Most often caused by structural or chromosomal abnormalities or congenital infection. Pathological process is in shrink to fetus and involves all organs including head. The next one types of an intrauterine growth restriction is asymmetrical uterine growth restriction. Affected in the later months during cellular hypertrophy. Total cell no remains same but size is smaller. Pathological process is often maternal diseases extrinsic to fetus. Diseases after fetal size by reducing placental flow or by restricting oxygen of nutrients transfer or by reducing fetus. What are the causes of intrauterine growth restriction? Often intrauterine growth restriction happens because of the fetus does not get enough nutrients and nourishment. So the important to in a pregnant women, so he eat more on nutrients food, not more on nutrients food, because it causes intrauterine restriction growth of a baby. This can happen if there is a problem with the placenta, the tissues that brings nutrients and oxygen to the developing baby. The blood flow in the umbilical cord which connects to the baby to the placenta. Intrauterine growth restriction also can happen if a pregnant woman. It also can cause during pregnancy of a woman if they use cigarette or smoking or smokes, drinks alcoholic drink, or uses drugs. If you uses that during your pregnancy has an infection such as cytomegalovirus, German measles or rubella, and toxoplasmosis or cytopils. such thing mentioned that you use that during your pregnancy time, the baby can't fully develop. And paglalabas na yung pagmanganganak na yung isang babae, pag yung babae ay naninigarilyo, umiinom ng mga alak, and uses drugs during their pregnancy, the baby is not normal. That have abnormalities of their growth. Kaya nga sinasabi ng mga Department of Health natin sa health center na iiwasan natin ang mga paninigarilyo, pag-iinom, at ano pang nakakasama sa pagbubuntis. Especially, if you are pregnant women, you take a nutritious food to developing normal baby. You can't use use drugs, smokes, or drink an alcoholic. That is not good as a pregnant woman. The important things to eat is nutrients, food, and nourishment to make a developing normal baby. Take some types of medicine such as some seizures treatments has a medical condition such as lupus, anemia, or clotting problems, has high blood pressure, hypertension, is carrying a baby that has a genetic disorder or birth defect. If you are in a pregnancy time, or you are pregnant women, do not use or eat na bawal sa iyong pagbubuntis. Kasi napakahalaga ang disiplina sa ating pagbubuntis to develop a normal babies. Kasi sa paninigarilyo, maaaring masisira din yung baga ng baby, masisira din yung heart ng baby dahil sa usok na nalalanghap niya during pregnancy time na naninigarilyo yung mother. And also, drink alcoholic drink, diba? Nakakasama din yung acid na ininom mo as a pregnant woman, mapupunta din sa baby. So, the skin, the developing of the baby is not normal. So, mabibigla ka na lang na the baby you produce during that time is abnormal siya, meron siyang abnormalities, kakulangan. Malaki ang ulo, maliit ang katawan, dahil sa mga iniinom natin, kinakain natin, at kinakain ng mga magulang na mga pregnant women. It's not me, because I am a man. So sorry for that Latin words. Overall, about the abnormalities growth inside the womb or the uterus of a mother is discipline. Discipline. As a woman that have carrying pregnancy baby, you need to discipline pag tayo'y kumakain. Eat nutritious food. Eat have nourishment food. Because the important as a pregnant woman, the developing normal of a baby. So avoid smoking, avoid alcoholic drink, avoid uses drugs, because that is causing by abnormalities of a baby. And also, the important things as a pregnant woman, consult your doctor and go to your health center. Just ask the midwife, the nurse to guide you. The important things is. That's in our latest news for today. Again, my name is Angelito Junior Montuerto Fernandez, student of Cotabato State University under by BPE SPE 1B. Magandang hapon po sa ating lahat. Keep safe and God bless.